Hi everyone, good afternoon. It's good to see all of you again. I don't usually see you, but I can imagine that you are all there. Thank you so much, viewers, for being with us today on Doctors Go Live via Columbia Asia Facebook page. Okay, today we're going to be discussing about dengue, and with us, consultant internal medicine physician of Columbia Asia Hospital Puchong, Dr. Muhammad Bin Shahruddin. Assalamualaikum, doctor. How are you?
Salam and good evening. How are you?
I'm good, Alhamdulillah. Okay, doctor, we're going to be talking about dengue because this is it's quite alarming, the rate at which dengue cases are
That's
increasing lah. Disebabkan I think we are concentrating a lot on COVID-19 that we tend to forget that we do have another fatal disease that has been in Malaysia for the longest time. So
yes.
itulah dia. Okay, while our country and the rest of the world faces a deadly pandemic, there has been a surge in the number of cases of yet another deadly disease, dengue. So this long-time enemy, okay, because it has been around and it has been apa ni? Memang every year lah we see rise in cases. So this is why it's very important for us to address this topic today. Okay, so maybe Dr. Muhammad, you can let us know first what is the current situation of dengue in Malaysia right now. Silakan, doctor.
All right. Okay. So I've prepared some slides for us to go through,
Okay.
so that it's easier for us to go through the points that I will make.
All
So
right.
an introduction, just to make yourself familiar. This is
Yeah.
our so-called enemy, which is the Aedes mosquito.
Okay.
It's easily identifiable. It's the
Mm.
body black in color, and then you will see
Mm.
stripes over the body and also over the legs and the hands. So just
Mm.
be aware, this is how it looks like. So all
Okay.
right.
Doctor, the apa ni Aedes mosquito ni, if we see very visible, I mean the size of the mosquito, is it bigger than the common mosquito?
The size is about the same, but you need to
Oh,
know there is just roughly speaking, there is a male and female, and only the female Aedes mosquito bites. So the male doesn't do all the biting because they need the blood to for the developmental of the eggs for them to create more mosquito.
I see, I see. But generally, can people identify which is the male or female Aedes mosquito?
Usually the one that we see in our houses, and
Mm.
at the time that I will mention later, it is
Mm.
female. So usually
Oh, I
we
see.
counter male much.
Right.
Usually the male mosquito, usually they go to fruits and trees to suck the nectar. So it's not
Oh,
much.
I see, I see. Okay, okay, all right.
As an introduction, one of the most important arthropod, we call it arthropod, is one of the insects borne viral
Mm-hmm.
disease is
Mm-hmm.
dengue. So it
Okay.
is mosquito, the name of Aedes aegypti. So this Aedes aegypti mosquito doesn't only spread dengue infection. Actually, if we heard previously, we had cases of Zika virus, and also occasionally we have cases of chikungunya virus. So these two other viruses are also spread or transmitted by this Aedes aegypti mosquito.
I
So
see. Mm.
so usually is available or create in the tropical and subtropical regions around the world. So we don't see much dengue cases in temperate region, for example, in USA and Europe. So it's more of tropical and subtropical. For example, in Asian, and then we see a lot of cases in India, some areas of Africa, and also mostly South America. Uh,
Okay.
and usually this mosquito predominantly we see it in urban area, in developmental area. So just to give you some overall idea how we are doing with the dengue infection in our country. In 2000, the dengue incidence in Malaysia is around 30 cases per 100,000 population. So it's quite low in 2000. As our country developed, so does the dengue infection. In 2014, the cases increased almost tenfold from 30 cases per 100,000 to 360 cases per 100,000 in 2014. So as we see from this graph, you
Mm.
can see in 2000, our cases is around 30 cases per 100,000 population. And then
Okay.
it in about 2014 and 2015 to around 360 to 180 cases per 100,000 population. But
Okay.
since then, when we had the peak in 2014, our government has been doing very preventive measure to reduce. And at the moment, we are hovering around 240 to 250 cases per 100,000. But as for this year, with the COVID situation, we see the cases is surging, and then it is most probably it will surpass numbers from 2018.
Oh, why is that, doctor? Why do you feel that, or why do you say that the cases have surged since COVID-19?
Number one, in terms of the numbers, and then
Mm,
I think because of when COVID happens,
mm,
because of the stay at home and work from home and all the children at home, because this
mm.
mosquito usually most of the time it infects us from home,
I see.
especially if our house area there is risk water retention in areas of the house. So with
Mm,
the number of hours that we are in the house, so I think this probably increased the risk of getting bitten by the mosquito.
I
So
see. I see. Okay.
if you compare to last year,
Mm,
up if you can see from the slide up to 20th June 2020, the
yeah.
cases already about 52,000 in Malaysia total.
Mm,
Last is around 59,000. And for death, also we know COVID causes death in our country, but
yeah.
at the moment for this past 6 months, there's already 90 deaths from dengue alone. So I think this is only we are only halfway through. So we have a battle ahead to control this dengue.
Yes. Doctor, you mentioned the countries that are facing dengue because of the temperature. Which of the country has the highest amount of dengue cases out of all the countries? I mean, in relatively, like in terms of Malaysia, ikut ranking the deadliness of dengue, which country would be number one?
I think in Asia we are one of the most high number incidents of dengue,
Mm.
followed by Thailand, and
Oh.
subsequently by Singapore and Indonesia. But Thailand
Mm.
has a very similar number from us, and
Mm.
most of the research. That's why from the WHO point of view,
Mhm.
Malaysia and Thailand in the world is one of the important country for
Mm.
dengue treatment and development. So whatever research that they need, they usually will refer to Malaysia and Thailand because we have most of the cases. And then
Mm.
whatever development in dengue in terms of treatment or prevention, most of the time they learn from us. So most of the guideline actually in WHO, if you see,
Yeah.
it's most of it is from us and Thailand.
Oh, inshallah. That sounds good. The other thing, doctor, is you were also mentioning that dengue happens a lot in urban areas. How come?
The thing about this mosquito Aedes aegypti,
Mm.
it's clean water, so it can't breed or it can't grow in dirty water. So as you know, we are a developing country,
Yeah.
and then a lot of construction at the moment. So
Yes.
with the construction, and if the area is not well kept in terms of the cleanliness, so
Yeah.
any amount of minimal water, even few drops of water, the dengue can grow. So basically, they can grow anyway.
Okay. Okay. Alright. So banyak dekat bandar lagi lah daripada
It's
uh,
correct. Hmm.
okay, okay, then rural areas. Alright. Okay. Carry on,
So,
doctor, with your slides.
so just to explain more about this dengue virus, to know more. So there is four subtype of dengue infection. So in our country, we have dengue 1 serotype, dengue 2, dengue 3, and dengue 4. So
Yeah.
the most common serotype that is available in our country is dengue 1 and 2. So you can see in the graph, 2013, 2015, the dengue 1 and dengue 2 serotype has been taking turns to be the most common. Dengue 3 and dengue 4 is available, but is in the lower range. Maybe in other country it's higher, but in our country predominantly these two type of serotype. So what is important to know? Why do it's important to know that we have these four serotype? Because once you are infected by one of the serotype, for example, you had infection by dengue 1 serotype, the next time if a mosquito carrying the same serotype bite you, you are immune, so you won't get the disease because you're immune for the type 1. But
Mm.
we hear patients who get multiple, sometimes two, sometimes three infection of dengue. So what happened usually is the second and third time they are infected or bitten by a mosquito carrying a different serotype of dengue. So for example, dengue 2, dengue 3, or dengue 4. And in dengue, it is dangerous because most of the time, your first infection, most of the time is mild. And when you have a second or third infection, this is where you can get severe dengue and complication can happen. So usually we see in outbreaks, for example, at the moment, most of the time one serotype will predominate. So for
Okay.
example, serotype 1, serotype 2. So in terms of the type, it's not important for us to know which type that we have.
Mm.
The treatment is the same, but this is more important for the public health measures on how to control.
Okay, doctor, I understand that you said that the type of dengue is not the type of, what do you call it? A serotype?
Serotype, yes, it's called
Serotype,
serotype.
okay. Oh,
Mm.
what does that mean actually? What is serotype?
The serotype is, for example, when you have a species, you have
Mm.
a serotype of that species. For example, um, another example is maybe influenza. For example, we have influenza A and B,
Ah,
and
okay.
the A itself, there is actually a lot of serotypes. I think
Okay.
there's more than 10 serotypes in influenza. So that's why, for example, when we take the vaccine,
Mm.
influenza vaccine, it covers all serotypes of influenza. So when we get the infection, actually we are getting that specific type of serotype in influenza. It's not the influenza per se. So it's the same as dengue.
Okay, with dengue, you mentioned just now that if you get the first round of dengue and then you recover, so that's good. And then suddenly you get another bout of dengue, and that is dangerous because it's the second
Yes.
time. Does this
Mm.
apply regardless of the type of dengue? That means
Yes.
are we supposed to regard like the first the different types? Are they? Is there a less one, or is there a, or it just doesn't matter as long as you
No,
are the
doesn't
time?
matter because once we got infected by dengue, what
Mm.
happened? Our body will produce immunity towards that specific type of dengue, and then the immunity in term of the antibody will stay in our body lifelong. So
Okay.
when another infection,
Mm.
so the antibody that is there previously from the previous infection, sometimes will have a more severe reaction. So our body will
Oh.
have severe reaction to the second or third dengue. So
Mm.
this is where the severe dengue can happen. It's not really because of the severity of the virus itself. It's
Mm.
more of reaction of our body because we have the previous antibody from the previous dengue.
So this is when the antibodies could actually be bad for us in case of a
Yes, it
second
can
attack
cause a
lah.
more severe reaction.
Right, right, I see. Okay, doctor. Your slide, sorry, you were going to continue?
So some details about the dengue. I think we need to know some of how do they live. So
Mm.
the lifespan is around 2 weeks.
Right.
So for the same mosquito can live and then can spread the dengue virus for 2 weeks. So that is the dangerous part. And then in these 2 weeks, they can lay eggs up to 3 times, and then each time they lay eggs is around 100 eggs. So the eggs actually they can stay dormant after they lay the egg. For example, if the mosquito lay eggs at some place that is dry, so the eggs actually can stay dormant for 8 to 9 months. So once they got in contact with, for example, water, then they can grow. So that is dangerous part. So as I mentioned earlier, only female Aedes bites us because they need the protein in the bloods to develop the eggs.
Yeah.
So usually what happen, the dengue will bite us and take the blood together with the virus from infected person, and then the virus will stay in the salivary glands of the mosquito, and then when the mosquito bites another person, so it will transfer the virus to the other patient. So basically
Okay.
the mosquito is transmitting the disease from person to person.
Okay, doctor. So that means it acts as a vector that
Yes,
transfers infected blood to a healthy person, and then dengue
correct.
happens.
Mm.
But how come the other mosquitoes don't do that? Because I mean, mosquitoes also bite, and they do go from person to person. Is there like some special mechanism that the Aedes mosquito has that's able to do that?
Because in this kind of mosquito, the specific thing that causes them to be able to spread is one, as I mentioned, they need the blood. So some other
Mm,
mosquitoes, for example, they don't need blood, so they can use all the, for example, nectar or anything from the fruits and flower to regenerate. For this
okay.
Aedes mosquito, they need blood. So that's why, in that sense, actually, they are trying to get food, but at the same
Mm,
time, they are spreading the virus from person to person.
okay. Okay. All right. No, I guess that means because as far as I understand, mosquitoes memang they okay. Well, they are the ones that are vegetarian lah because they go for fruits and vegetables. But generally the mosquitoes when they bite and then that's actually there's blood involved
That's
because
sorry, blood.
it's only Aedes mosquito, is it, that transfers blood?
Yes, because for example, we have other type of mosquito, but for example, if you heard about malaria, so
Yes.
malaria is also transmitted by mosquito, but this is a different type of mosquito, and usually this type of mosquito is not available in urban area. It's more concentrated and more they grow in forest areas or, for example, jungle. So we don't have malaria. That's why we don't have malaria in the urban areas. So the
Yeah.
Aedes mosquito are actually the one that are predominate in urban areas. So
Okay.
that's why the same mosquito, as I mentioned earlier, can spread Zika and chikungunya. So for example, if we have an outbreak of Zika
Mm.
that area, so if there is a vector, for example, mosquito, it can easily be spread.
Okay. All right. All right. Okay. So, okay, doctor, sorry. Do you want to explain the slide? Because I've got another question actually for you.
All right. So maybe you just go through this. Is I think I took it from KTM.
Yes, yes.
How do we identify this Aedes mosquito? So number one, as mentioned, it can be known by the belang hitam putih pada badan dan kakinya.
Mm-hmm.
Usually, the Aedes will only bite during early morning and early evening. So we call
Yeah.
it at dusk and at dawn. So these are the
Okay.
times that we need to be careful because this is where when the mosquito is very active in trying to find food. So
Mm.
the Aedes will lay their eggs in clean water. So
Okay.
they don't go to look for dirty water, and then
Yeah.
usually they do it inside or outside the house.
Mm. Okay.
So the whole process after laying the egg until it becomes a mosquito that can start to bite is around 1 week. And then once they start biting, or as an adult mosquito, they can stay for 2 weeks.
Yeah. Okay. Doctor, did you mention just now that the the container, water containers, or the breeding grounds for the dengue mosquito, for the Aedes mosquito, is mostly outdoors or both outdoors and indoors?
Both outdoors and indoors.
Oh, okay, all right. So that means even that we all have commonly in most households are the water dispensers, kan? And then usually there's a container at the bottom of the water dispenser
Yes,
where water,
that
right?
can be a dangerous area for it to
Oh,
breed. So
okay.
later I will show some pictures lah to see where is the common place that usually in our house and outside our house that they can breed.
Right, I
So
see. Mm.
just to give a brief introduction
Mm.
for how dengue infection can happen. So number one, usually is broadly classified into dengue fever and dengue hemorrhagic. So dengue fever, usually you have a sudden onset of fever,
Yep.
usually can last up to 7 days. The symptoms commonly is intense headache, body ache. They can have joint pains. You will definitely lose your appetite. You can have
Mm-hmm.
nausea in some cases. You can have vomiting, and towards the end,
Okay.
usually you have skin rashes. And when you have this dengue infection, when you do blood test, full blood count, usually it will show low platelets and also low white blood cells.
Okay.
So, contrast in dengue hemorrhagic fever, whatever happened in dengue fever is there, but additional, you can have severe bleeding.
Sorry.
You can have severe bleeding, for example, gum bleeding, nose bleeding, and bleeding into the skin, as well
Right.
as organs. So, if the dengue hemorrhagic fever is not picked up early and not treated early, it can cause organ damage, and this
Mm.
in these cases, the patient can eventually die from dengue.
So, okay.
So usually the fever will be around 4 to 7 days after the mosquito bite. So this is called incubation period. So for
Mm.
example, if you're bitten on Monday, you can get it. You can start to have symptoms by maybe Thursday or Friday. So 4 to 7 days. For example, in context, if you compare for COVID, for example, if you are exposed to COVID, you
Correct.
will roughly develop the disease after 14 days. So that's why our
Yeah.
quarantine is 14 days. So that's just to
Mm.
put it. So as I mentioned earlier, I think the symptoms I've already mentioned: fever, headache.
Yeah.
Most commonly, the patient usually complain of the pain behind the eyeball and also
Yeah.
pain at the back. So
Right.
that's why we call it as break bone fever, because the pain is like breaking your bones. And
Oh,
the rashes can have after day 3 and day 4, and as I
yeah.
mentioned, cause vomiting and diarrhea.
So we're not just talking about fever and rashes. Like there's actually a lot of pain involved when you have dengue
Yes,
fever.
most of the time the patient will be very miserable for the
Mm.
first 2 or 3 days, because this is when they can have intense headache and very bad joint and muscle pain. After
Is
that,
the
the
pain different?
symptoms slowly
Sorry, is the pain
exaggerate.
different for adults and children?
Usually, it will be more severe in adult,
Okay.
but generally the symptoms wise is the same we see in children.
Yeah. Okay.
Okay, all right.
All right.
So I think this is just a picture cartoons from I got it from KKM lah. So basically it mentions whatever that we have. So maybe it's better for illustration lah. So we can
Mm.
see that fever, sudden onset and high grade fever. The fever will be there usually about 4 to 5 days. You can have
Okay.
rash, body pain, joint pains, and then you can
Mm.
have bleeding below your skin, the
Yeah.
nose and the gum. Okay.
Mm.
Okay. So next thing is we need to know how do we confirm you're having a dengue. So
All right.
In Malaysia, when you have fever, for example, after 3 or 4 days of fever, and the
Mm.
fever not going away, so the
Yeah.
first thing is dengue. So
Mm.
we can say we need to consider after 3 or 4 days of fever is dengue until proven otherwise. So this is the message that we need to know, because some of the patient do come late to the hospital. For example, they wait until day 4 or day 5 of dengue. So
Yeah.
sometimes when it's detected, the platelet is very low, and sometimes there is already organ damage. So the message is after 2 or 3 days, sometimes maybe after 3 or 4 days, if the fever is not settling, then you there's no choice for us to check the blood test, because that's the only way for us to diagnose dengue.
Okay. How early can dengue be diagnosed? Let's say I have fever today and I go to the clinic immediately. Can dengue be diagnosed at that point in time, or does it take 3 or 4 days of fever before
Usually, the earliest time to diagnose dengue is day 2, because as you can see in the slides I mentioned about the blood test that usually we use in detecting
yeah.
dengue. There
Mm.
is 3 type of blood test. Number one is, we call it NS1 antigen. So NS1
Okay.
antigen will be positive usually from day 2 to day 4 or 5. So when you
Okay.
come early, usually the doctor will do this NS1 antigen. So
Okay.
sometimes in the early disease, for example, day 2, day 3, your platelets might still be normal, but the
Yeah.
NS1 will be positive. But if you present to a doctor maybe later after 4 to 5 days, usually we
Mm.
will do IgM antibody and this will be positive.
I see.
It's
Okay.
actually as early as day 2, lah, I can see.
All right.
Okay.
Okay. Next slide. There you
Right.
go.
Okay.
This is about treatment.
Yeah. So when we have dengue infection, we need to know there is no cure for dengue. So there's no medication or there's no specific treatment or drugs that we can use to treat dengue fever.
Mm.
So other important points is doesn't require antibiotics, because antibiotic works in treating bacteria, not virus. So
Mm.
in dengue, what we need is actually supportive care. The most important thing is fluids. You can say it's
What?
the only treatment is fluids, water,
Fluids.
because
Okay. Okay.
in dengue, what happen is it will cause our blood vessel to be
Mm.
fragile, and sometimes the water or serum from our blood can leak out
Yeah.
from our vessel. So this will cause dehydration. So that's why the mainstay of treatment is actually to maintain adequate hydration. So in some cases, if the patient require admission,
Mm.
usually, if the patient can't maintain a good oral intake, that's when we need to put in intravenous fluids, where we will infuse the water in the body. And
Mm.
usually, patient will need frequent blood test monitoring, sometimes up to 4 times a day, to monitor the blood counts.
Doctor, since you mentioned that dengue has no cure, does that mean that when a patient recovers from dengue, that is basically, like you mentioned just now, it's supportive.
During the active infection per se, there's no
Mm.
cure. So most of the patient will go through the same sequence for all patients. Usually they will have fever, and then
Mm-hmm.
after the fever there is a critical phase, and then after that they will go into recovery. So it will be about the same for every patient. So the duration will be around 6 to 7 days. So after the patient goes into recovery, then the platelet will start to increase, and then after that we will take another 1 week for the bloods to return to normal.
I see. I think maybe because I have not read much about dengue, which I should have lah. Because the impression that I get whenever people say that they have recovered from dengue is that because they have been treated and then they have
Mm,
responded well to the medication or
mm,
the treatment,
mm.
then they
Actually,
you know
no. Actually, no. So
heal.
for all patients, they will go through the same stages.
Okay,
So the treatment actually is just supportive. You are just giving fluids, and we're
good.
giving, for example, treatment. For example, if you have fever, we will give paracetamol to help with the fever. If you
Okay.
have having vomiting or diarrhea, we will give medication for that. So, but for dengue per se, there's no medication.
But whether a patient recovers or not, does that depend on the patient's immunity?
The immunity from dengue usually will be provided by, after you get infection, the body will produce the immunity. So the recovery usually doesn't really depend on the immunity of the patient per se,
Okay.
but we need to take note. For example, if the patient has prior medical problem, for example, diabetes and hypertension and chronic illness,
Oh,
sometimes in this patient, the severity of dengue can be worse.
I see. Okay.
Okay, so in a small minority of person, if for example the dengue is not recognized early or
Yeah.
the treatment is not sought early, so this is when they can have multi-organ failure. So it
Mm,
can have liver failure, it can cause kidney failure, heart failure, and eventually patient can die.
I see. Okay. Is dengue prevalent more in adults? I mean, cases of deaths. Is it more prevalent in adults or children or the
Basic,
elderly?
basically, there's no increased prevalence in adult. For example,
Mm,
in this is just based on who got bitten. So, for example, if the child got bitten, because once you get bitten and then the virus transmit to you, most of the
mm,
time you will get the infection,
okay.
whether is it mild or it is severe. But
Okay.
it doesn't predominant whether is it children or adult.
I
So
see.
whoever got bitten can have the disease.
I see. So there's no particular patient profile, like it's random.
No, no. Mm. So everybody can
Right.
get it, but the
Mm,
severity will be depending on number one whether you have a previous dengue, and number
right.
two other illnesses. For example, what we see is diabetic and hypertension, heart disease. So when
Mm,
you have all these chronic diseases,
mm,
most of the time and sometimes actually you can have a more severe dengue.
okay.
So this slide showing some of the advice because we
Mm,
need to know not all dengue patient has to be admitted because for
mm,
example thousands of cases every week, so it's not possible to admit everybody. So what happened is we usually admit patients who are having very severe symptoms,
right.
or for example the platelets are very low, so we need a closer monitoring. So these are the advice that we can get. This is provided by KKM if, for example, in patients who are not admitted. So number one,
Mm,
once you have dengue fever, you need adequate bed rest. And then number
okay.
two, as I mentioned, the mainstay is fluid intake.
All
So
right.
we usually advise for patients to have at least 2 to 2.5 liters per day, at least. So what type of fluids that we can take? Actually, you can take anything from
Mm.
milk, fruit juice. You can take
Oh.
coconut. You can take plain water, barley water. So as long
Mm,
as it's fluids, then it's acceptable.
mm.
Um,
Coffee and tea and sweet drinks, they don't count now, of course.
Coffee and tea actually it's okay if you can take, if
Oh,
you have the appetite to take it, it's okay.
I
There's
see.
no problem with that.
Mm,
But usually we advise patient to mix up their fluids because most of the
mm,
time they don't have appetite to eat. So we still need
yeah.
nutrition. So we advise patient to take the
Right.
nutrition in terms of fluids. For example, take milk, fruit juice, you can take
Mm,
coconut juice, not only plain water. Okay.
okay.
Other than that, for the fever and the pain, it's advisable to take paracetamol, but need to be according to the recommended dose,
Yeah.
not more than 4 grams per day. So maximum
All
is
right.
4 times a day.
Yeah.
We can use lipid sponging to reduce the fever,
Okay.
and yeah. Other than that, the don'ts that we need to know is usually in dengue we don't prescribe the painkiller because this can be dangerous. So the only medication that is safe is paracetamol or Panadol, and then we try and then antibiotic as I mentioned is not required, and we don't advise patients to take injection because this one can be dangerous. For example, if the platelet is low,
Mm,
the patient get injection, it can cause bleeding and swelling.
I see. Doctor, paracetamol is not a painkiller.
Paracetamol is considered a mild. That is the first step. Is the most mild painkiller.
I see.
So
Okay.
it's considered, as I mentioned, if you can see, we call non-steroidal anti-inflammatory disease (NSAIDs). So these are the things that we can avoid. So basically, in dengue, we can only rely with paracetamol for the pain. Avoid
Okay.
all other painkillers.
All right.
So these are the advice, and then what are the things that we need to know? Because as I mentioned, not every patient will be admitted. So
Mm,
if these danger signs, or we call it warning signs, happen when you are staying and resting at home, you need to come to the hospital. Number one, when you have bleeding. So bleeding can be either from your nose, from your gum. You can have
Mm-hmm.
bleeding from the gut, for example, if you can notice a black colored stool. And then
Right.
if, for example, if you have a period during the infection, you can have heavy menstruation. So if you have this warning signs, you need to come to the hospital. And then when we have frequent vomiting, so as I mentioned, vomiting is normal in dengue, but when
Yeah.
you have severe or frequent vomiting, for example, more than 3 times a day, then you need to come to the hospital because this is considered a warning sign.
Okay. All right.
Next, when you have severe abdominal pain,
Mm.
when you have diarrhea, and then this is more for, I think, maybe more for elderly or for pediatric population. If
Okay.
the children becomes drowsy and very irritable, so we know the patient is getting worse.
Yeah.
uh, the other thing is sometimes we can see if the patient's having dengue is having pale, cold, clammy skin, difficulty
Yeah.
in breathing. So this few other points, for example, point 4 to 6 is already, if patient's having dengue, this is signifying severe dengue. So we need to bring the patients to the hospital immediately.
Okay. Do the all these symptoms, do they happen at the same time, or
Usually you will have one of the symptoms. Usually you won't get all, but these are the symptoms that I mentioned. This is the
yeah.
warning sign if you are having a severe dengue. So you can have overlap, maybe one or two symptoms.
Yeah.
Usually it will be one or two symptoms which are predominant.
Okay. All right.
Okay. Okay. So before we go to dengue prevention, do you have and do you want to be clear or anything?
Okay, sorry, we just go through the checklist very quickly. We look at causes and the types of dengue. Then, oh yeah, I wanted to ask you about mosquito bites. I mean, of course, it's, yang Aedes. The Aedes mosquito. How many mosquitoes does it take for a person to become sick with dengue?
You mean how many times we need to get bitten to get the infection?
Something like that. Because does it mean like one mosquito bites the patient with dengue and then goes to a healthy patient, and
Hmm.
then that patient gets dengue immediately, ataupun it takes like a few bites.
I think
You know, that
theoretically
virus,
you can, if for example, because as you know, as I
mm,
mentioned earlier, when for example the mosquito doesn't have any virus, so it will go and bite to get the blood from the patient who has dengue. So the
correct,
dengue
yeah,
dengue virus will be with the mosquito, and
yeah,
then the dengue virus will actually replicate in the mosquito salivary gland. This will take 1 or 2 days. So
mm,
once the dengue virus is the numbers is adequate in the salivary gland, so the
mm,
next time the mosquito bites another patient,
mm,
the blood, automatically they will release the fluids from the salivary gland into the patient. And then theoretically, with one bite, if the number and concentration of the dengue virus is significant, then you can get infection only with one bite.
okay, that's very scary actually. That's something that I've always wanted, but wasn't sure. So one mosquito bite is all it takes for us to
Yes.
get dengue.
Yeah.
Okay, reality check.
Okay.
All right. Oh, lagi, what else have we not spoken? We spoke about symptoms, and then symptoms of dengue. Are they the same for every person? Yes, they are. Symptoms easily confused with other diseases.
Other diseases, because when we talk about infection, for example, fever, most commonly that we see, actually apart from dengue, usually we can have flu. For example, flu is influenza, and
Yeah.
then more common from influenza is actually your common cold. So common cold is just like your sesama. So
Yeah.
sesama is common
Mm,
cold. So you have to
mm,
differentiate common cold and influenza, because common cold is just caused by a lot of respiratory virus, and
mm,
usually it will be will be treated by symptomatic treatment. But for
Okay.
example, if influenza, you
Yeah.
need a specific treatment for that. And in terms of symptoms, they can overlap. But usually, what differentiate it from dengue usually is in dengue you won't have much of respiratory symptom. For example, you don't have much of runny nose, you don't have cough and sore throat. So
Okay. Doctor, out of all the symptoms, the dengue symptoms that you've just described, which symptom is memang like unmistakably ni memang dengue lah. You don't have to, you can't mistake that for any other diseases.
So number one, in terms of the characteristic of the fever, usually it is sudden and very high temperature,
Mm.
very high in grade. For example, it can reach up to 39 to 40. So usually
Mm.
other infection, for example, common cold or influenza, usually it will be around 38, 39. Won't be that high. So dengue usually it will go very high. And then
Okay.
as I mentioned, the degree of the the degree of the muscle pain and the joint pain is usually it's worse compared. So I would say probably the body pain and the joint pain will be the one of the characteristics
Okay.
other than the we mentioned.
All right. Okay. Okay, which one should we suspect dengue? I think that one you addressed already. We have heard. Okay, doctor. I think this is something that needs to be addressed. We have heard of common home remedies for dengue, such as crab soup and papaya leaf water. Is there basis for these kind of claims, or is it just
So I
uh,
think we have in Malaysia we have a lot of this traditional remedy. So
yes, yes.
when you
Mana
have
yang
dengue, yeah, when you have dengue, your friends and family will start recommending. I'm sure this will happen to anybody.
yeah.
So for me, in terms of the evidence that we have,
Mm,
number one, for the crab soup, usually we use crab soup. So there's no clear evidence to say it's helpful. But again, it's as long as it is not harmful and it's not
yeah,
causing other harm, then for me it's okay because it's also can be considered a type of fluids. As
all
for the young papaya leaf, actually there is study done by University of Malaya. I think it was
right.
done to see
Mm,
whether there's a difference in the dengue outcome when
yeah.
you take the papaya juice, papaya
Okay.
leaf juice. So I think from that studies says that it doesn't change the outcome of the disease itself,
Yeah.
but it shows very minimal increase in the number of platelet. So
Oh,
it has a minor effect in
right.
helping
Yeah.
to platelet earlier, but whether or
Okay.
not it causes your dengue to be recovered early or not, I don't think we have that evidence. So basically, whatever fluids that you can take, as long as it's not harmful,
Mm,
we prevent it.
okay. Okay. All right. Actually, those are all the questions that I have, but we can also take a look at the questions that the viewers have, which they have already left in the live comment section.
Mm.
But before we go to their questions, do you have anything else to add to your slides, or have we come?
I think the last part of my slide will be the prevention. So
Okay.
basically, to prevent the infection, to prevent infection is actually is as easy as preventing the mosquito bite. So as I
Mm,
mentioned earlier, they like clean and stagnant water. So
okay.
basically, what we can do at home is we get rid of all the stagnant water in our house or outside the house. Okay.
Okay. Oh, that's all. Sorry. Oh, okay. Okay. Sorry.
So this picture shows the areas that usually we can see in our house. So basically, you can have it in your kitchen, you can have
Yeah.
it in your flower vase, in your
Yeah.
toilet, in your water filter, as you mentioned, water filter, the filter there, and
Yeah.
then some fridge. If you mention, I think the older fridge they have the like a bekas below the fridge that collects the
Oh, yeah.
water.
Yeah.
I think previously that was one of the most common cause of dengue infection in the house, but I think the modern fridge don't have that anymore. And then
Yeah.
your pail baldi, most of the
Mm,
time some there is water because
mm,
for the eggs to develop, it only needs few ml of water. For example, if we have a water by the thickness of, for example, 20 the 20-cent coin, they can develop. So that's the amount of water that they need. So we need to keep everything dry. So if that area is not used by us for any reason, so if it's stagnant, then we need to get rid and make sure it's dry.
Okay. Doctor, apart from the breeding grounds, from breeding grounds of the Aedes mosquito, okay, what about things macam the mosquito repellent sprays, ubat nyamuk yang biasa and all that? I mean,
I'll mention it.
very
I'll mention
little, but yeah, all the sprays, do they help as well
yes, yes.
in getting rid of mosquito, including the Aedes mosquito?
Hold on, let me go to my slide. Actually, I mentioned it later.
Oh,
Okay.
okay. I saw the picture. Aerosol. Okay, all right.
Okay. So number one, the prevention will be there'll be two parts. So number one is to prevent the eggs from being laid. So usually, basically, removing stagnant water to prevent the mosquito to grow. Number two is to kill whatever that mosquito is already available. So there's these are the few of the things that we can do. Number one, you can use the mosquito repellent, as you mentioned, when you go outdoors. You can use mosquito repellents. Number two, you can use light color clothing, and then long sleeve prevent from get bitten. And then at home you can install insect screen or doors. Last time we used to use bamboo, but I don't think now is very useful because I don't think it's trendy. So we can install insect screens on our doors and windows, and then mosquito nets, and also, as you mentioned, insecticide. It's useful.
Yeah.
Okay. All right. So how do you use? Because we know it can be used, but for example, aerosol.
Yeah.
Number one, you need to use the correct one, and then number two, when you want to use it, close all doors and window. So usually, what is the advice? I think is also mentioned on the bottle usually. So you spray the aerosol in. For example, if you want to spray in your room, you spray, for example, at least 5 to 10 seconds, and then you close the door for at least 10 minutes. So you stay outside, and then after 10 minutes, then it should be adequate.
Okay.
So this works.
All right.
And then these are the mosquito repellent. So this is when we go outdoor. For example, if you go for runs in the morning or evening, where when the mosquito is active, then we can use this mosquito repellent. So apart from our long sleeve and long short, you can use the repellent. This is helpful.
Okay.
So yeah.
Okay. Doctor, I have one more question. When hujan kan and the water collects today, tomorrow there will already be, I mean, if there is dengue mosquito lah around your in the house compound. So tomorrow there could be jentik-jentik already, or it takes, sometimes I think people feel that alah tak apa lah, it's just kejap je kan, like 2 or 3 days. Later on they realize that, okay, there's actually water there and they have to
As I
empty.
mentioned, the danger is because the eggs can lay dormant for 9 months, as mentioned earlier. Kan? So, for
Yeah.
example, if they lay the eggs, for example, to lay at the dry area, so stay dormant for ni. When you have rain, and then that give the water and the food to the eggs, and then it can grow. Usually, once the egg touches water, usually it will take the whole process will take 6 to 7 days for it to become mosquito.
Right. Okay. 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 I guess the lesson in all this is for us to just become vigilant all the time lah.
Correct.
Okay. All right. Let's take a look at the questions that we have. We take one
Sure.
question. Okay. In the meantime, a lot of people are saying hi to you. I think from
Hi.
Puchong and Shah Lemon, Shah and all. Okay. From Wawa, hi dok, nak tanya kalau perempuan mengandung ada kesan pada bayi tak?
Okay. So this one is also important. I thank you for the question, because yang berkenaan dengan perempuan mengandung adalah agak penting, sebab bila kita mengandung memang risiko untuk kita menghadapi masalah semasa mengandung memang ada. Terutamanya kalau for example at any stage of the pregnancy, for example if the dengue is severe, as I mentioned, kita punya platelet can be low, boleh rendah, platelet can be low, and then you can have bleeding, and actually there is risk for bleeding. For example, bleeding from below for the woman, and also there is some cases unfortunately in cases, for example, if the dengue is severe enough, we can lose the baby. So it's very dangerous, and then that's why, as I mentioned earlier, bukan semua pesakit dengue perlu admit, tapi there is some caveat. So if you go in for the characteristic of patient that need to be admitted, nombor satu, patient tu menghadapi dengue yang teruk, for example severe dengue, very severe symptom. But the third thing, one thing that we need to know is, for example, for pregnant lady, if you have dengue and then you go to the hospital, most of the time you will get admitted. Whether the dengue is very mild or very severe, you will get admitted, because we never know which one you can get. So that's why untuk perempuan mengandung perlu berhati-hati. So bila ada demam lebih daripada 3-4 hari, kita perlu check untuk dengue, dan kebanyakan masa kalau positif, pergi ke hospital, doktor akan pastikan untuk kita masuk, walaupun dengue itu adalah mild, sebab memang ada risiko untuk menghasilkan masalah untuk kandungan.
Okay, hope that answers the question for Miss Wawa. Okay, there's another question from Miss Anis. Okay, from Miss Anis Nur Afika. Hi doctor, if someone tu dah pernah kena demam dengue, orang tu berisiko untuk kena demam dengue lagi tak?
Okay, so sebelum ni masa awal tadi pun saya ada mention regarding this. So sebab dengue ni kita ada 4 serotype ataupun 4 spesies dengue. Dengue 1, dengue 2, dengue 3, dengue 4. So contohnya bila kita dah dapat infection daripada dengue jenis pertama, kita masih boleh dapat dengue kedua, ketiga dan keempat. So basically kita masih boleh dapat dengue infection selepas dijangkiti dengue. Okay.
So bertanya, demam one off, adakah itu satu simptom dengue?
Okay. So macam saya mention tadi, in dengue kita boleh dapat from the mildest form ataupun from the severe form. So in terms of the mild form, sometimes the dengue boleh jadi demam hanya sehari atau 2 hari. Kemudian hari keempat kita akan rasa demam tu sudah hilang. So ini berlaku kebiasaannya dalam bila kita mendapat jangkitan dengue yang pertama. So sometimes kita rasa macam it's just a one off fever, 1 hari 2 hari and then dia hilang. So kita masih boleh dapat dengue macam tu. So sebab itu masanya bila pesakit datang ke hospital mendapat dengue yang severe, dan bila kita dari segi darah kita boleh detect bahawa patient mempunyai sejarah dengue yang sebelum ni, tapi bila kita tanya, sakit kata tak pernah kena dengue, tapi sebenarnya dalam darah boleh tahu patient ada dengue. So kebanyakan masanya dengue yang pertama tu dia very mild and then kita pun tak perasan. So maybe demam untuk 2-3 hari and then we don't think it's serious kan, lepas tu it's just flu. So the next time we have dengue tu yang boleh jadi teruk. So balik pada soalan tadi, memang kita boleh dapat dengue one off, boleh kata mungkin 1-2 hari, and selepas tu dengue tu hilang, demam tu hilang.
Okay, but if you in cases like that, if the patient goes to the hospital to do a test, of course the hospital would be able to, the test will be able to tell whether that person already has dengue or not. Okay.
Even the mildest form of dengue, if you do the testing, it can be positive.
I see. Okay. Mr. Barjish Paul is asking, do we have any medications to increase platelets?
Okay. So as I mentioned earlier, there's no medication for dengue. So there's no medication for dengue, and then usually the increase in platelet will be depending on our body response to the infection and also the severity of the dengue. Because eventually, 100% of the patient, the platelet will go up. And then we need to understand, because most of the time, I think this is probably some misconception in the public, that the platelet is the most important thing in dengue. So for us doctors, actually the platelet is just a marker to know where is the stage of the dengue. So even if the platelet is very low, sometimes the disease can be mild or moderate. So it's actually not important to increase the platelet too early, because this is just part of the dengue stages. It will go up by 6, 7, 8 days. It will 100% of dengue case will go up. So usually we are not too worried about platelet. And going to the question, there's no specific medication to increase the platelet,
Okay.
because one, it is not important. So
Yeah.
even if the platelet is not low, the patient can still have a very severe dengue. So
Okay.
we don't have to worry too much about the platelet.
Okay. All right. There's a second question by Mr. Barjish Paul, but I'm not sure what that means. Or any fruits and veggies for a vegetarian person. Okay. Not too sure actually what to make of this. The two questions. So we will just go to a question by Shahruddin. In the meantime, Mr. Barjish, if you've got a question, if you want to restructure your question, you can do so. You can just type it very quickly, and then we'll address it. In the meantime, let's go to a question by Encik Shahruddin. Dr. Muhammad, swimming pool is considered stagnant water. Means dengue
Okay,
can be. So what
thank
are
you for
precautions
that,
to prevent
Jasharuddin. So
the pool? Good
swimming pool
question.
is not considered as stagnant, because usually when you have swimming pool, the one with the proper pool, usually they have a system of the filtering, so the water is actually most of the time is filtering. So
Mm.
thing is considered as stagnant. But if you have, for example, your not homemade, it's like a balloon pool that usually you use for kids inside or
Yes,
outside.
yes. Mm.
So you don't dry properly after using, that can be a very dangerous place for it to break. So be careful regarding the indoor pools that we have in the houses, for example, for kids. But I think
Yeah.
for the commercial or hotels pool, there's no risk, because it's not stagnant.
Yeah. Okay. Painkiller is not, sorry, a question by Mr. Fitmanso. Painkiller is not advised to take even when we are having a bad headache and body ache. Why, doctor?
Okay,
I
thank you,
think you
Fit. As I mentioned earlier, the only safe medication to use is dengue in paracetamol. So the
right.
reason, we know in dengue you can have bleeding. So one of the places that can develop bleeding is our stomach. So this, when you take NSAIDs, for example, normally if you know, we know about Constant, we have Voltaren and all that. So this NSAIDs, actually, when we use in dengue, it can increase the risk of bleeding, especially in the stomach. So because of our cells and all the lining will be fragile during dengue, so when you
Mm.
take the NSAIDs, which is considered quite strong, and then it can increase the possibility of bleeding in patients. So that's the reason we avoid all this medication.
I see. Okay. So, well, it looks like we have come to the end of the session, and I would like to thank you very much, Dr. Muhammad Bin Shahruddin, who is a physician with Columbia Asia Hospital, Puchong. Thank you so much, Doctor. And hopefully, actually, I was just going to say that it has been very enlightening because dengue, I think sometimes people tend to take it for granted because
Mm.
every day is like dengue. You hear about it, you read about it.
Mm.
So maybe there's not
Most
enough attention.
most of the time we see, if your friends or your family got
Yeah.
dengue, only
Yes.
will seriously. But we
Correct. Yeah. Yeah. Yeah,
everybody
otherwise,
can
it's
get
like
it.
dengue, the mom. 'Cause people don't really know that. But the the fact yang macam I paling wow sekali, I mean wow in a bad sense lah, is that only one mosquito is what it takes for somebody
Yep.
to develop demam dengue. Okay, well, thank you so much, everyone, for joining us today on Doctors Go Live. Inshallah, we'll see you again with
Okay.
another topic. Thank you, Doctor. Bye.
Okay.
Assalamualaikum.
Thank you. Waalaikumsalam.